Can you tell me a little bit about the sort of problems you've been getting? You've had some trouble with your stomach, I understand.
Yeah, I get pains in my stomach. I've had them for about 2 years. And they're really bad, but I can't do anything.
Yeah.
So my mum looks after me.
Can I talk to you a bit about the pain itself and how it affects you and things like that? Whereabouts is it? Can you show me?
It's sort of about there, but then sometimes it kind of moves across to about there.
Right, so it can be in different places?
Yeah, but it's always in my tummy.
Always in my tummy, okay. And does it come on at different times?
Sometimes it's worse, and then, but it's always there.
Right. There are things that make it worse?
No, it's just, I don't know, it just hurts sometimes more than other times.
Yeah. Are there things that you've done that make it better?
No, it's really bad.
Right. Okay, it's bad all the time?
Yeah.
And has it affected your life? Has it affected how you go on and do the things that you normally enjoy?
I like painting and drawing, and I used to go to a day centre with my support worker, but I had to stop that because I've been at home in bed and my mum's been looking after me.
Right.
So that was about half a year ago, and I've just been in bed really for the last couple of months.
Right, so it's really affected you. You've had to take to your bed.
Yeah.
Yeah. I understand you've seen lots of people about your pain. You've seen your GP and you've been up to the hospital and seen people and you've had a lot of investigations.
Yeah, I've been to see lots of doctors. They told me I had irritable bowel syndrome and I had gallstones, but it doesn't go away.
It doesn't go away. Have you tried any specific treatments that anybody's recommended?
No, well, they can't give me any medicine for it.
Right.
That's what I need, really. I want it to go away and then my life would be all right again.
Right, okay. And have they explained to you what they think's going on?
No.
No, okay. Right, so you're not really sure what it is?
No, I just get a sore stomach.
Okay. Can I ask, do you get any other symptoms as well? I understand there might be some other things that you experience.
Yeah, sometimes I have fits. I get dizzy and I go a bit blank and I get a bit shaky.
Right. You have fits?
Yeah.
What happens there?
Well, I get dizzy and shaky and then I just go blank.
Okay.
And they last quite a long time.
Do you pass out completely? Or
No.
you're kind of aware of what's going on around you when they happen?
Yeah.
And you've been having those for the same period of time, these last few years?
Yeah, quite a while.
Okay. You said you feel dizzy sometimes, unsteady?
Yeah.
Yeah, okay. Do you get pins and needles? Or do you get pains from anywhere else in your body, from your joints, from your head, from your back?
No, not when I'm having a fit, just when I get sort of achy joints and tired when my stomach hurts.
Yeah.
But that's not when I feel dizzy and strange. I just, yeah.
I've asked you a little bit about your tummy. I've asked you a little bit about some other physical symptoms. Do you get just to think about some other things? Do you ever have any problems with your periods, with pain from your periods, or difficulty with the regularity of your periods?
Yeah, they're not very regular or very often. Sometimes they are, sometimes they're not. Yeah. Sometimes they're a lot and sometimes they're only a little.
Okay.
But.
Okay. All right. Just to go through a few other things, because I'm interested in all of these different symptoms that you're getting from all over the place. And it sounds like they're having a huge effect, but do you have any problems with your heart ever? Do you find your heart running away with you?
No, I get worried sometimes. That makes me feel not very nice, but no, other than that, it's just my tummy.
Problems with your breathing, your chest getting tight, your throat closing or anything like that?
No, not really.
Okay. Do you have any specific concern about what you think might be causing this?
No.
Sometimes when people have...
No.
Sorry.
No, I just want it to go away and then things will be all right again.
Okay. Sometimes when people have got these kind of symptoms, they become fixed on one thing and they think maybe it's this that's causing it. Or they might be particularly certain that there's something going on that people haven't uncovered. Does that?
No, sometimes I worry because it's in my tummy and my dad died and he had problems with his tummy when I was little. Sometimes I think it might be that, because you can get things that are hereditary. I've seen it on the telly.
Yeah, yeah.
But
Your dad died because of problems with his stomach?
yeah, he had cancer and he died. But I was only little.
Right.
But
How old were you when that happened?
About 4, 5.
You remember that?
Well, I just remember him being poorly and then he wasn't there.
So, just to help me get it clear in my head, you've got this full range of symptoms. They've been going on for quite a few years now, and it's really affected your life in the sense that you spend a lot of time in bed. You don't get out in the way that you used to. You don't get to do the things that you used to. You've been to see lots of doctors with lots of investigations, and they haven't been able to provide you with a clear answer as to what's causing it. Okay.
In this sort of situation, how might you help the patient understand the relationship between their physical symptoms and the underlying psychological issues that are causing them?
When I'm seeing patients who have medically unexplained symptoms, I guess I have 4 areas in mind that I like to work through and understand about the patient's experience and help them to see. The first of those is the process of somatization. The idea that we're all capable of experiencing our emotions, particularly stressful emotions, as physical symptoms. We can use examples from our own life, such as tension headaches and butterflies in our stomach, to help people see that that process is normal. And I guess I'm hoping that the patient will understand that that's what's happening to them on some level. The second step is the way that those experiences and feelings can be amplified by how much we focus and concentrate on them, and looking at with the patient at how they may be focusing on it and making the symptoms worse. The next step is to think about what they believe is causing the symptoms, looking at their attribution. If they feel that it's caused by a severe underlying physical illness, then I guess that's an area of thinking that we're going to need to address with them. But more than what they actually think is causing it, we need to think about their own views of how controllable it is, how likely it is to be long-term, and how likely it is to recover. And the final area is to look at the behaviour that follows from all of this. What kind of behaviour that they're engaging in. That might be repeated consultations, repeated reassurance seeking, attendance at the general hospital, or disabling symptoms in which they don't engage in the meaningful activities of their day-to-day life, that they seek benefits, things that are going to sustain them in a disabled and sickness role.
Have you got any tips for GPs about how to cope with patients who make recurrent unreasonable demands?
I guess the first thing to recognise here is that this is a group of patients that all doctors may feel frustrated by, and that's often driven by the fact that they feel unable to help this group of patients. So the key message initially is to ensure that you can convince the patient that you believe them and that there's a message of hope that they can recover. Where I think many practitioners and general practitioners perhaps included will get stuck is thinking, well, where do I go from here? And I guess the key thing is that tackling the symptoms head on is often not the way to do it. I think we need to think very carefully about a patient's quality of life and what is it that they're getting from their life that helps to give them purpose, meaning and fulfillment. So a focus on the patient's quality of life, not as a diversion, but as a key focus around self-help is very important. I find in terms of engaging patients, there's a number of very useful websites depending on what symptoms they're complaining of. If they're functional neurological symptoms, then neurosymptoms.org, run by some neurologists and psychiatrists in Glasgow, is very helpful. Has a lot of personal patient accounts of their own journey, and many of the patients that I see have found that useful and inspiring. If we're looking at non-epileptic attacks, then the NEAD Trust has a very useful website. And this is run by people who have this experience and the carers of people with this experience. So very focused on the experience of patients. And the old favourite of patient.co.uk has some wonderfully helpful leaflets on psychosomatic problems and somatization disorder. In terms of being able to help people to plan their own recovery, then another useful resource from the internet can be found, which is called the Pain Toolkit. Although it's specifically describing the issues of pain, it actually, and the document itself, relates to any chronic symptom that a person may be experiencing. And it breaks down into 12 steps, the kind of key aspects of approaching any long-term symptom, beginning with the important factors of acceptance, adaptation, and building a support network around you, of which the GP is going to be a very important first part. As a GP, you can't do it all for this group of patients. A key message is that, and the people that do well are those that learn how to help themselves. And so enrolling the supportive carers is going to be very important, because if they've got views that challenge the views that you're helping, then you may need to bring them into to a shared understanding of what the patient's experiencing. Finally, there's some fabulous evidence from pilots in London that if you can work out who these patients are who are presenting regularly, then by recognising them as a practice, aligning them with a single GP and seeing them on a regular basis, this actually reduces their overall level of general practice attendance and has been shown to reduce their level of service utilisation in the general hospital, such as through the A&E department and outpatient clinics. So regularly seeing the patient with the same GP and booking those appointments in advance is important in providing reassurance and continuity for the patients.
How would you manage a patient who's known to somatise but then presents to you with a new physical symptom?
To a great extent, this is going to depend upon the relationship and understanding that you share with the patient. With the patients that I see, and I think in most patients with somatization, it runs a chronic course in terms of their presentation of psychosocial stresses through physical symptoms. And so by developing a shared, often metaphorical understanding of how that happens with the patient, you can take new symptoms and understand it through the metaphor that you share. A metaphor that I find very useful to think of is one of burnout, the idea that our brains and our physical systems run something like a computer, and when we increasingly tax the computer that many of us will have in our own homes, it will eventually start to glitch, the fan will go on, it'll start to run more slowly. And to use the analogy that the symptoms that we can develop in our body are often brought about through a similar overload of our system. So I think it's important to take some time to listen to and understand the symptoms, and of course to look for any important red flags that need to be followed up through medical processes. But of course it's equally important then, if that doesn't reveal any concerns, to start to ask the person about what's going on in their life. If you share that understanding through, for example, a burnout metaphor, you can start to look at what additional things are taxing their system and how these symptoms that they're developing anew may have some meaning and relevance to what's going on in their personal lives.